Let's talk about what to do when you've suffered a traumatic injury. The first thing you want to assess is whether you're able to move the injured area. If you're able to move the area, even if there's some pain, then that gives you some information about where you're at. If you can't move it or the pain with movement is pretty extreme, I recommend contacting a medical professional immediately. That could be your chiropractor, your physical therapist, an urgent care center, or your primary provider. If you're able to move the area, even with some pain, you can then assess, can you put weight on it? Can you stand and put your weight over that injured leg? If you're able to do that, then you can assess if you're able to walk on that injured leg or foot. This again gives you some information about what you might be able to tolerate for the early phases of rehab. If it's the first 72 hours after the traumatic injury, ice can be appropriate. You can use ice packs like this, or frozen peas, or submerging the area in an ice bath. Ice is going to constrict or close the blood vessels. This can help to reduce the inflammation if there's excessive inflammation. If your ankle's turned into a grapefruit, for example, then ice is probably beneficial at that point. Ice is also going to slow the healing process, and the blood cells that go to the area that create the inflammation are part of the healing process. So some inflammation is good, so you don't need to be too worried about it. But if it's after 72 hours, you might want to do a contrast therapy where you do a little bit of ice, a little bit of heat, 10 minutes of one, 10 minutes of the other, and go back and forth. So you get the closing of the blood vessels, slowing down the inflammation, but then you open up the blood vessels, allowing for that circulation to help heal the area. Once you've dealt with the first 72 hours and you've done the ice, maybe some contrast therapy, then you want to start looking into keeping the area moving. As mentioned in the first video, the body is going to lay down tissue to help protect and stabilize the injured area, and that can contribute to a lot of stiffness. So to prevent it from getting really stiff, you want to try to keep some movement. So you can do things just like easy movement, just back and forth, and assessing what you're able to tolerate. Pain is your body's way of talking to you, so you want to pay attention to your pain levels. Any exercise you do in the acute phase of injury, I recommend starting with pick a movement, try it for 10 reps, and you want to gauge if throughout a set of 10, does the pain improve? If your pain remains the same, it's probably not that helpful. If the pain is getting worse, you want to stop. You do not want anything you're doing to make your pain worse. However, exercise can be a really helpful part of the healing process, and you can do it immediately and safely. Once you've assessed that you're able to move the injured area with the tolerable amount of pain, now it's important to gauge what amount of movement is okay, what's too much, and what's too little. Remember, some inflammation is okay, and really movement is going to be the best way to get that blood flow to the injured area to help encourage the blood cells that help heal the tissue to continue to go to that area. So it can be really helpful to maintain some amount of movement early on. You just want to make sure it's not excessive. So you want to have the rule of anything that you do should not make your pain worse. Whether it's moving the wrist, straightening the elbow, walking, the rule is you want the movements that you do to either not increase your pain, then it's not making it worse. And then if it's an exercise you're doing to try to help heal, that you want that to make the pain better. So any exercise you do, let's say you pick one movement for a set of 10 reps. If there's pain in the beginning, which is okay, you want that pain to steadily decrease as you do 10 reps. You do not want your exercises in the beginning to make the pain worse. Remember, pain is your body's way of talking to you. So if you're continually increasing your pain, you're aggravating the area, you're exacerbating the injury, and you're probably lengthening the healing process. So do yourself a favor, either listen to your pain and only do what feels okay to you, and then contact your medical provider, your chiropractor, your physical therapist, your urgent care center, or your primary care provider to get professional help to help assess what's the most appropriate thing for you at this point in time with your injury. I hope that helped answer some questions about what to do when you've suffered a traumatic injury and you're in acute pain. Let me know if you have any questions.